Hello, everyone. Nice to meet everyone virtually. My name is Sultan. So I'm a second year plastic surgery resident at Northwell Health. We're at a couple of different hospitals in New York City and Long Island. This will be a pretty interactive session, I hope, just to make it interesting for everyone. I know you've probably been through a million Zooms this past year. So I'll just touch briefly on med school tutors. So I've been a tutor for a couple of years, mostly step one tutoring. That's kind of how I got started. This is actually only my second webinar, so I'm still new to webinars in general. So I do appreciate any feedback as well there. But med school tutors is great. I mean, we're really a team that covers a whole comprehensive take on, getting through med school, getting into the residency of your choice, succeeding in residency, career mentoring. So it's, it spans the entire gamut, essentially, whether it's just coaching, whether it's tutoring, if you have questions, if you need help with interviews, all of that stuff, I think it's really a wonderful organization with fantastic team members who are all sort of there, who have been through the process and who can help get you to where you want to go. So what we'll talk about tonight, a couple of different things. So one is sort of my path to medicine in general and how I really got there from, I would say, a relatively early age, how I specifically chose plastic surgery, because that was definitely a later development. That was really more towards midway through med school, I would say. We'll talk about a typical day, what it's like to be a resident. And obviously, there's a lot of variability there as far as what a typical day actually is. And then again, a question and answer session just to talk about all the stuff that you guys want to talk about. So to start, I think I got into medicine pretty early. It was somewhat easier for me because I do come from a family of doctors. I know within my med school class, it was sort of split. I remember the first or second day, they had everyone kind of raise their hand if they were coming from a family of doctors or if they were, sort of the first one in medicine in their family. So I was one of those from a family of doctors who knew about medicine, who knew what it was kind of like to be a doctor, what the work-life balance was like, what it meant to sort of interact with patients and be around patients. So I definitely got started early. I would say I was definitely interested. I remember being interested in high school, so pretty early on. I remember sort of tailoring my undergrad experience towards getting towards med school and really gaming that out. And I'll talk a little bit about that. And then after that, the main thing is really confirming that passion, doing all the experiences that I needed to sort of make sure that this was definitely what I wanted to do. And that's true for residency too. I think to the extent that you can, and it's really hard for medical students sometimes to appreciate this, but to get all of the experiences, the different kinds of experiences that you can to confirm that it's actually the right residency for you. Because I think one of the worst things, unfortunately, and it happens sometimes, is to end up in a residency and it's not the right thing. And you thought you saw yourself doing it, but then all of a sudden you don't, and then you're stuck. And it's not something that you can't get out of. But again, I think having those experiences beforehand really helps to make sure that this is what you anticipate actually doing and what you see yourself doing on a regular basis. And I think that's the goal. Finding mentors, that's a big part of that. Even early on in undergrad, if you can, sometimes it's, finding a research lab and someone who can help you with that. And sometimes it's finding people in the field that you can shadow and talking to them about what it actually is like on a day-to-day basis. And I'll talk about that as a resident. But again, you're only a resident for a certain period of time. So naturally, you really want to know what it's going to be like as an attending, not so much as a resident. So that's kind of the early start to medicine and the things to sort of think about. And I know some of you guys are obviously beyond that point at this point in your career. So for me, pre-med and med school, I'm lumping them together a little bit. But as I said, I think the first step for me was really finding people that I could reach out to who could help me get to where I wanted to get to. So that meant finding a lab, both in undergrad and then also in med school. Where I was at NYU, it was, it was pretty easy. There were a lot of great research labs. There were also a lot of people doing clinical research. Eventually in the field that I wanted to go into. And even when I just started and I wasn't really sure what I wanted to do at that point, I still was able to do a summer internship in a lab And those are opportunities that you can sort of find early on in medical school, or even, in your second or third year prior to applying, just so that you, again, are working closely with someone who can really show you what it's like even to just be involved in research, if that's going to be a component of your future career as well. I think the big thing is doing all the things that you can to really fully visualize what it will be like within that career. And so shadowing helps, but it's not the be all and end all, because again, shadowing, sometimes you're just doing your best, like empathetically to sort of see yourself in a certain role and to try and internalize those emotions that the person that you're shadowing is going through, and to try and put that all into perspective. But it's not perfect. And so you do have to take all of that with a grain of salt. And so sometimes I remember as a medical student, so I knew that I liked being in the operating room a lot. And so that was a big first step. But at the same time, as a medical student, sometimes you're in some of these interesting surgeries and you're, 3 or 4 people back watching the surgery, and you're like just kind of glimpsing over someone's shoulder. And you're like, well, surgery is cool and maybe operating room is interesting, but it's hard for me to really visualize what it will be like because I'm just looking over someone's shoulder. And that's not very realistic, because that's not really what surgery is. So again, how do you sort of fully visualize what that's like? And I think that's the trouble as a med student. And that's why getting as many experiences as possible is really helpful, because eventually you'll be in the operating room and you will be the one even doing the surgery. And so trying to get in the operating room enough, if surgery is something that you're interested in, is helpful, just because you put yourself in those experiences enough, and eventually you get to the point where you can make it meaningful, and it does become worthwhile. Working on your resume, this is something that you guys, I'm sure, are all familiar with, and it's an ongoing process that starts already from the time you're in high school, undergrad, med school. It's a constant process. It's about being sort of well-rounded and making yourself seem like someone who has a lot of different things covered, so that you're, if you're going into competitive fields, so that research is a priority. You have different work experiences so that you can sort of say to them, I have seen this field, I know a lot about it, I'm really interested in it. I've spent enough time working with people in the field that I know that this is something that I like. And that's reassuring, again, to the residency selection committee. And that's important for them to know. Is this someone who just found their way into this field, or have they really thought about it? And are they, a good bet for someone to invest in? And I would say that's incredibly important in plastic surgery. It's a 6-year residency program for the integrated track. And the people that we work with, our faculty members, have sort of invested in us, because they're going to teach us and they're going to be with us for 6 years. And they only pick a certain number of us. So it's pretty selective. And then they have to be willing to sort of mentor us through that whole time period. So they want to know that we're quote unquote safe investment in that sense. And then again, another little plug for med school tutors. Figuring out testing is important. And I would say it is very important for competitive specialties. It's important for plastic surgery. It's important for a lot of things. I know, at least in plastic surgery, that a lot of my faculty members care about, and a lot of the sort of residency selection committee, that consists of all of those faculty members and different people, what they care about ultimately is some sort of quantitative assessment that they can go by to say, this is someone who will do well, who will test well, because for better or worse, that's something that they believe in. And it is important. It gives them some sense of, how well you can incorporate knowledge and give that back and whatnot, and how quick of a learner you are. And so again, for better or worse, that's something that is important in plastic surgery and some other competitive specialties. Okay, so this is pretty important. So beyond even just figuring out kind of the field that you want to go into, and this was a journey for me, but finding the right program for you. So for competitive specialties, you need to do a lot of sub-Is, and I imagine some of you have been told this, but picking your sub-Is is also important. It's almost like picking a program, because you're picking the places that you want to see for a closer look. And for something like plastic surgery, where it is a 6-year program, the residency that you ultimately go to, they will want to know you well enough that they feel like they are willing to invest in you for those 6 years. So they won't necessarily always be inclined to take someone that they know very little about, or they just know about them on paper. A lot of times it's nice for them to have met you beforehand and to have a good sense of who you are, so that you're not a sort of surprise to them once you actually end up in their program. And that's very true for plastic surgery because it's pretty selective. A lot of programs have, 1, 2, 3, or maybe sometimes 4, but usually more like 2 or 3 residents a year. And so again, these are people that they have sort of hopefully picked off a list, and that there's some kind of mutual agreement where you want to go to their program and they want you to, and then it's like a happy marriage. We'll talk a little bit about the match process too, but I would say the selection of sub-Is is a part of that system for you as well, to decide to reach out to a couple of places and say, I want to see more of your program. I'm really interested. I want to spend a whole month with you guys. And so that's something that I did. So I had done a research year where I took off time between my 3rd and 4th years in med school. And so at the end of that research year, I then had to sort of go back to med school. And the first step of that was applying to all of these different programs around the country and saying, I want to get a closer look here and here and there. And I tried to spread it out geographically so that I could see what I wanted, how I felt about different geographic locations. I tried to spread it out as far as picking different programs that I thought would also help me to find mentors, and again, letters of recommendation, which is important too. That's part of having like a well-rounded application. And so that was my choice. So I ended up going to California. I went to Dallas and I went to Chicago. And I had been coming from New York. So I already sort of knew some of the New York places. And it was a really enlightening experience because I went to all these different places. It was 3 months in a row. And at the end of it, I had sort of realized that I didn't really want to leave New York in the end. So that was helpful for me because it was a process of going to these places, seeing what else was out there, comparing and contrasting. And then at the end of the day, saying, where do I think I'll be most happy spending, 6 years of residency, still in like developing years of my life. And you have to take that into account. And so even for a 3-month stretch, I think that was long enough for me to say, I could see myself going to some of these places, but I think I'd still be happiest where I was, where I had my friends and family already. I would say that's not something to be taken lightly. Education, training is incredibly important, but you don't have to sacrifice that while also thinking about quality of life and what will ultimately, keep you sane during residency and keep you happy. And so those are things to think about too. Part of how I found plastic surgery in general was, the way I sort of saw a lot of the attendings, and from talking to them and understanding what they did, I thought it was a great field that's sort of technically challenging and interesting and unique, but also has and affords quality of life and an ability to sort of enjoy both training and education and all of that stuff while also, taking time for yourself. So that was important. And that was important too for ultimately my residency choice for going to Northwell. From talking to the residents, from knowing, some of them beforehand, or having that sense, from like having those discussions, from really seeing their program, from visiting, that I realized that was where I would feel most comfortable, where I would feel like part of that team. And so that's when it's a good fit. And apparently they liked me too, so it worked out great. And so that's really what I would hope for all of you as well. So now we'll talk about kind of a day in the life. So this is, I would say this is very variable. It's very variable in plastic surgery, but it's also kind of variable in general for residency, no matter what kind of residency you do. And I say that because sometimes there are clinic days, sometimes there are operating days. It's an interesting field because you have so many different types of experiences. There's a little bit of patient care, there's a lot of operative experience, and then there's a mix of all the other stuff that's also important as part of education and training. You have to study. We do take a test every year that's called an in-service exam. Residency programs will have some version of that, whether they call it the ABSITE in general surgery or something else in another field, but some version of a test, usually on a yearly basis, that challenges you to study and to keep up with your reading so that you are prepared ultimately to pass your boards in that field and to actually be a board certified physician in your field. And it's important also to have some time for unwinding. So I don't have an actual like schedule up because our schedule ends up varying so much, but here's a rough go at it. So I would say we round usually in the morning anywhere from like 6 to 6:15, sometimes 6:30 if there's not a lot going on in the morning, but usually maybe like I would say 6:15 on average. When you're an intern, usually you'll have to get there a little bit earlier and you get the list ready and you don't have to necessarily pre-round on the patients because usually for surgery rounds, we tend to be kind of efficient with it and the team will just see the patient together. But you'll chart check and make sure that you haven't missed anything from overnight and you'll look over, their vitals and see what's going on with them, what happened overnight, intake, output, all of that stuff, get a sense of the patient from whatever happened since you last left the hospital, usually like, I don't know, let's say 12 hours beforehand, right? So then you get your, list of patients ready with all of those numbers and all of that like information. And sometimes that will take you, 15 minutes and sometimes it might take you longer if there are a lot of patients on your list. And then, I'm already a second year. So now I get to like roll in basically for rounds, which is nice. And the senior residents and the chief resident at that campus will come, a couple of minutes before rounds and we'll all get ready to round together. The intern will have lists ready for everyone. And then we start to see our patients. Usually we'll see patients over, 45 minutes or so, depending on how many patients we have. Unfortunately, a lot of times surgery rounds are early. So you're sometimes waking patients up in the morning. Occasionally they're up and waiting for you. And we'll typically go in there. We tend to do focused rounds, which is nice because, you sort of realize that a lot of times you are a consultant. So, and we have primary patients as well, but as a consultant, you have a sort of focused view about what you're looking for, what you're being consulted for. So if there's a wound or something like that, that's really what you want to look at. We can talk to patients about their nausea and their tummy ache and all of that other stuff. But sometimes we'll have to leave that for the primary team to take care of just because our role as a consultant is really to focus on what we're being consulted for. And so that's why rounds tend to be pretty focused. It doesn't typically take that long to see everyone. We'll regroup together about like 7 o'clock and just go over the chief resident will like make plans for the day and sort of tell, junior residents, like, let's reach out to this team and to this other team and just sort of touch base and put in the notes for the day. And that will happen usually over the next half hour. And the operating room usually gets started around 7:30 for some cases. So if we have a lot of first starts, we'll have to sort of move some things up to make sure we're done with all of that stuff beforehand to get to the operating room. And so that's really where most of the bulk of the day is spent in and around the operating room, which is what I, obviously look forward to. And that's the highlight of my day, getting a variety of cases and working with a variety of people. And so I would say anywhere from like 7:30 to, depending on when the day's cases go, until sometimes if you're on call for that night, and we're usually on call around once or twice a week. So you might get assigned to late cases that would go until like sometimes 8 or 9, but sometimes not. And then if you're not on call, you might wrap up your day as far as operating by like 4 or 5 o'clock, sometimes a little later. If there's a busy day, then everyone is stuck until 6 or 7. And, cases, sometimes you'll have one long case. Like yesterday, I was in a case that started, that was the first start. So it started about 7:30 and we finished and it just went straight until about 4:30. And that was just one case. And, obviously you can take a break to go to the bathroom and, to grab a quick like bite to eat or whatever. And then you just scrub back in. And then sometimes you just have like 4 cases back to back. And so there's enough time in between where they're cleaning the room and setting up the room for the next patient that you have a break to sort of sit down, check your messages, like, go eat something, go to the bathroom, do all that stuff. Quality of life during the day is important too. You have to check in. And then you get to the end of the day, usually we'll talk about anything that happened. If we have a couple of patients, see at the end of the day, sometimes we will, just to sort of touch base, because now it had been all the way since 7 in the morning that we had seen some of these people. If anything had happened and we want to, just get an update. So at that point we do. And then whoever's on call, we'll just make sure everything is sort of wrapped up for the day. We do home call, which is really nice. So, you turn your pager on and you drive home at that point and you hope that you don't have to come back to the hospital overnight. And I would say maybe 2 out of 3 times you just take call from home and you might get paged overnight, but you get to sleep in your apartment and everything is fine. You just come back to the hospital the next day and maybe you got woken up once or twice, but you got a relatively good night's sleep. And then sometimes occasionally, I would say this happens maybe a third of the time, maybe not even, but you might get called overnight that you have to come back to the hospital and either see someone in the emergency department, which doesn't happen too often, luckily, with our call schedule, or you have to go see a patient on the floor because the nurse is worried about something or there's something that happens. So, I mean, yeah, it's kind of, I would say, ultimately, a pretty fair schedule. It's heavily concentrated around, Monday to Friday. You take call on the weekend about once a month. So 3 out of 4 weekends are also kind of fair game, do whatever you want. I live in New York City, I live in Queens, being close to the city, I can sort of do what I want. During COVID, that's a little bit trickier as far as the experiences and opportunities that are out there, which we can talk about too. But so I would say, I think it's a good balance. It's the balance that I had thought about when I was a med student applying and thinking about different programs. And I think doing sub-Is at these places and sort of seeing what was out there and how residents sort of split their time, that was helpful because then I could say, like, this is a program where everyone seems really overtired and I don't know how happy I would be for 6 years or how sustainable that would be. And then specifically in my case, so for Northwell, having talked to them beforehand, I understood that their call schedule was very reasonable. They were getting great training. I had heard their chiefs were going to good places. Like everything was it was exactly what I wanted to hear, and it was perfect, and it is. And I'm like, I couldn't be happier essentially because I'm getting the training and the education I want. And I think they do a great job too of allowing us to have some kind of quality of life outside the hospital, to have a lot of weekends a month where we don't have to be in the hospital, where we're free to sort of pursue other opportunities and hobbies and all the other things that we want to do. And to recharge because, it's a busy schedule. Any surgery residency generally comes with, a little bit more towards the work-life balance. But making those opportunities, having a reasonable call schedule, taking home call, I would say, means that you don't have to do as many of these 24-hour shifts where you literally are in the hospital for like 25, 26-hour periods. You don't even see daylight for a long time. So I would say that was an important consideration for me. So that kind of wraps up the day in the life. So, we talked about this before, but med school tutors, I think, the big thing is, we have a great team and we have people who can help you at all different levels. And so if you're past maybe step 1, maybe even past step 2, but you have questions about interviewing and residency counseling and all of that stuff. So we have specific residency counselors as well. So all of these different things, I would just make a plug in general for med school tutors because it's a really great organization. And I think they can help you get to where you want to go. So hopefully that kind of gave you some sense. I know I talked a little bit in general about a lot of things. Now we can sort of launch into the question and answer part of this. So technological advancements related to plastic surgery that we're really excited about. So plastic surgery is a really cool field because there's a lot in it, I would say, where we're working with occasionally, like you interface with industry a lot because there's a lot of money in plastic surgery too. And there's a lot that people want for themselves. And so there's a lot that is constantly changing in the way that we can help patients to get where they want, whether it's from an aesthetic surgery standpoint and also from a reconstructive surgery standpoint. A lot of times, and ideally, you sort of get this balance where there's funding and there's industry support for something that also aligns with your own goals and your own, what you want for your patients. So whether it's like a burn patient who, has extensive skin loss and needs coverage. And so they're working on, different technologies for like cultured epithelial autografts and things like that, ways of having those alignments. So I think that's really nice. So when we can work with industry and we can, advance the field, I think that's really cool. I think there's a lot that comes out within aesthetic surgery from a technological advancement standpoint. Occasionally we'll learn about it because we have to be up to date on it. It's something that a lot of plastic surgeons in the community might be offering to their patients. In our residency program, we work with a lot of private attendings as well as, some of the faculty people at our hospital, and the private people may be offering things that the faculty members won't be. And so we get those opportunities to sometimes see their patients in the office and see them do a demo with the newest laser that they got, maybe cool sculpting and other stuff, and to just understand at least what it is, whether it's going to be a part of your career or not. So I think that's helpful. But yeah, I think technology makes the field really interesting. I think plastic surgery in general is a really creative field. It's less about the specific procedures that you do and really thinking about a problem and how you can fix it, and creative techniques within skin and soft tissue all over the entire body, from a reconstructive standpoint, from an aesthetic surgery standpoint. So technology is always, welcome in the field. So I'll take the next question. So just to read out, I'm an older medical student interested in surgery, maybe plastic surgery, I guess. Do you come across many older residents? So I do. I mean, I think because it's a competitive field and it takes a while to get there, and sometimes people have done other things before going into plastic surgery, there are older residents. In our program, we're definitely mixed. We run anywhere from one of our residents had been in the Army, and he's a veteran. He spent a few years before going into medical school, pursuing that and some other things, and then finally made his way into medicine and then plastic surgery. So he's, a little bit older than us, still, part of our residency family, obviously. And then we have one or two other people also who did pursue short other careers before joining, before going into medicine and plastic surgery, or one of them had a career sort of in medicine, but not specifically as a doctor. So there are definitely different roads towards getting there. And I don't think that there's any sort of discrimination. In fact, sometimes it's the opposite. Sometimes whoever is on that residency selection committee might appreciate a sort of alternate route where there's more life experience, where they have pursued other things first and know that plastic surgery is really what they now want for the rest of their lives. And so I think that, no matter where you come from, you can still make that your future as long as, you sort of make headway towards all of those goals and getting there. Hopefully that kind of answers that question. So the next question is, usually plastic surgery residency applicants have a large number of publications and presentations. Could you advise how we can be more prolific in research? Quality of publications, what's considered low and high qualities? So that's a great question. I think research in general is tough, especially as a med student, because sometimes you have all these mentors around you, and sometimes you don't. And even if you do, even if you're in a place, that's academically competitive and there are mentors around you, getting a foot in the door is not always as easy as you think. And you can email a lot of people and get no responses. And sometimes you can talk to residents and they'll have different projects and they'll give you stuff to do, but it doesn't always turn out to result in anything. So it's tough. I think, at the level of a med student, I think trying to get as many opportunities as possible is probably helpful, because in that sense, not everything is going to work out with all of those different research opportunities. But if some of them stick, at least that's a way of getting not so much just publications that you can put on your resume CV, so that you can have that mentorship opportunity, so that you can at least be able to talk about your research. A lot of times in interviews, that's something that they'll talk about. So it goes with the entire package, I would say. But it's important, I would say, for competitive fields, for plastic surgery, they're going to look to see what kind of research experience you have. It will be, usually something that's important, that they will want to know that you have done research. And all of that being said, I mean, they may not everyone is going to be able to publish in Nature and Science and Cell and whatnot in med school. So I don't think that they're going to be on you about having the highest quality research. But even if you have sort of lower quality clinical research, if you can talk passionately about it, if you can make it happen, if you can advance it, if you were even the sort of go-getter med student who drove the project from start to finish, who came up with the question and then found support for it, and you saw the project through from start to finish and even wrote the project and you wrote up the publication, then even if it's a low quality thing, but you can at least convince them that you're interested in research, you understand how it's done, and you're doing your part even in your role as a med student to further research, to further development in the field. And so I would say that was one of the things that, for me at least, was the most difficult to sort of find research opportunities, to find mentors, to see those things to fruition, because in your role as a med student, you don't have the power always to like push it towards publication. A lot of times you'll need the residents to give you projects or to help you with the clinical stuff. To give you the patient data that then you get to analyze and come up with ideas about. And if it's a basic science project, and that was a lot of what I was doing in med school, then it takes a lot of time. You have to put a lot of effort into it, and you're part of an entire team in the lab working on projects, and some of them work out. And sometimes you work, for half a year on something and not much comes of it. But at least if you can put together a poster on it and then talk about that and explain that what you were working on has value, and it's something that you can come back to. So even that is of value too. So I would just encourage in general to try and find a lot of different opportunities. Again, you'll see what sticks, and that way at least you're not disappointed if you just sort of put all your eggs in one basket and you're going for this one publication and it just doesn't work out. Okay, so 2 questions. So I'm pre-med and thinking about going into this field. I'm confused about the difference between cosmetic and plastic surgery. So there isn't really a difference. I mean, there's just the field of plastic surgery. So the way that it works is usually within plastic surgery, there's a focus as far as our training and our education on learning, I would say, techniques to dealing with, and this is historically the way plastic surgery sort of came to be founded. So a way of thinking about, different problems that exist within, like from a surgical standpoint for a patient, and how you can address those problems in the most creative way. And so transplant surgery actually got started within plastic surgery, surprisingly. And it's not really so surprising, but it's a way of thinking about different problems, different surgical problems. And some of the most creative people within surgery were in plastic surgery, because the field got started by thinking about these problems and thinking of creative solutions. So I would say it had its foundation in reconstructive surgery to some extent, especially after the world wars, and thinking about treating a variety of different issues, extremity amputations and wounds and things like that, and facial trauma, fractures of the face and other parts of the body, in conjunction with orthopedics, a lot of soft tissue exposure and loss and wounds. I think one of the nice things about the field is we work with so many different types of surgeons on a daily basis. I say we somewhat regularly talk to neurosurgery. We do cases with them for complex cases that they have, like for spine cases, for cranioplasty cases. Those are cases that we'll do with them because part of the spine surgery will be, on them to, put in hardware or whatever it is. And then in order to reestablish soft tissue coverage, so we may do muscle flaps. So that would be like more of a simple, straightforward case from our standpoint, a complicated case from their standpoint. And then a cranioplasty surgery, for example, will work sort of hand in hand with them. Someone is missing coverage, they're missing part of their cranium, so we'll work with them to, reestablish some kind of support and structure. If we can do like a split calvario bone graft and something like that. So it depends. I mean, it's a pretty complicated field. So we'll work with them. We'll work with orthopedics a lot for extremity trauma, for coverage, for having soft tissue flaps. We'll work with breast surgery a lot from a reconstructive standpoint. That's a big part of our field, and it's a big part of our training. And then again, so then cosmetic surgery, it may have had its foundation a little bit within sort of reconstructive surgery, adapting some of those techniques that we are aware of from, how you can safely move tissue around, like for fat grafting, for breast reconstruction, but it can also be used in cosmetic ways. And we think about it a lot in cosmetic surgery, but it's then taken back towards reconstructive surgery if someone has like tissue atrophy in their face and they need fat grafting to parts of their face. So I would say we work where we think about these techniques and these procedures, and then tailor those techniques and procedures to the patient and what they're actually asking for. So if they're asking for reconstruction because they have some kind of wound or they have some kind of defect, or are they, coming to us because they have a lot of soft tissue laxity on their face and they just want that support that they used to have. And so, yeah, I mean, that would fall under, quote unquote, cosmetic or aesthetic surgery. But the techniques that are used are some of the techniques that may have originated in other parts of plastic surgery within that reconstructive field, or maybe not. And I think the two go hand in hand, and our training is sort of cumulative in that sense. I think it's what makes plastic surgery interesting. You're not just learning how to take out someone's gallbladder. You're learning that there are 100 different ways sometimes of reconstructing a different wound. And then you have to decide based on your expertise and based on all the different factors related to that patient and the circumstances of their care, what you can do to best get them from, their point of having a certain defect or having a certain issue, and how you can make them better again. And you're sometimes their lifeline towards getting back to normal. We think about that a lot with breast reconstruction. Obviously breast surgeons are incredibly important for taking out the breast cancer. And we owe them that, encouragement and support to, help all of these women, but at the same time, leaving them with complete defects and mastectomies sometimes is untenable, obviously, and it would almost be a barrier for a lot of patients towards getting those procedures, because that kind of morbidity is pretty high. And so giving them back quality of life and sometimes giving them back breasts or ultimately however you reconstruct, and give them back what they want, that kind of quality of life, that's something that they're incredibly appreciative for. And that's how you feel and how you get your fulfillment on a daily basis. Sorry, I know that was kind of long-winded, but hopefully that kind of addressed some of that. So I do think of them as all part of the same field. And then within that, I mean, when you get up to the point where you're an attending and you can specialize and you decide what it is that you want to do and how you want to set up your practice, you can sort of then decide, do I want to do mostly cosmetic surgery for patients who don't, quote unquote, have a real defect, but maybe have something that they identify in themselves that they would like to be augmented or made better. And that can be the bulk of your practice, or you can also, base your practice around reconstructive surgery and then be in consultation constantly with a lot of different surgeons from different fields and dealing with the different reconstructive aspects that exist within surgery. So actually, yeah, my father is a doctor. He's a general surgeon, like a regular general surgeon, which is kind of cool. That doesn't happen as much now. Even within general surgery, they tend to sort of specialize. So I definitely did get in the operating room with him early, and I realized, I think at that point, that surgery, for me at least, was interesting, and I enjoyed it a lot. It was definitely meaningful to me. I wanted to do something within surgery, but then I had to sort of navigate to plastic surgery, because eventually, once I started shadowing and seeing plastic surgeons operate, I knew that I like the sort of technique-based thinking, the creativity that they had. So it wasn't so much about here's a procedure that we're going to do, but here's how we like think about this problem, and here are a couple of different ways that we can fix it, and really like elegant and creative ways of putting that all together. So that was sort of how I got, at least from general surgery to plastic surgery. So I guess you can sort of wrap up. I appreciate just having the opportunity to talk to you guys. Hopefully this was somewhat helpful. I know it's sort of general, but it gives you some sense. And I would just say, in general, whatever field you end up deciding that you want to go into, do your best to really get all of those opportunities to shadow, to talk to residents, to talk to attendings, to really make sure that you found the right field, because when you do, it's incredibly rewarding. And I'm really happy for that. It makes going to work interesting and fun and exciting. And I think, I want that for all of you, obviously, as well. And so getting there means really doing your part to make sure that, you found the perfect fit for yourself.